I would like to get out walking the dogs. Wilbur and Ruby are getting very bored.
So, welcome, Jim Burpee. Thank you so much for spending some time talking to us today about your experience with the COVID-19 illness. I think we'll just start at the beginning. How did you know that you had the virus?
Because I was very familiar because my older brother, 85 years old, died from it back in April in Wisconsin. So I started developing a cough. First I thought it was just a cold, but then I started to have all of these ache all over symptoms all over the place. Stuffy nose, achy back, poor appetite. One of the things that I'd read about that became apparent very early is difference in taste. Water tasted funny. Food didn't taste like it should. No appetite, so that made me suspicious. The symptoms kept getting worse, and so I saw the doctor in the ER at the hospital, and they decided that they ought to put me in the hospital and put me in intensive care.
So you were in intensive care, and just kind of talk to us a little bit about how your symptoms went from the time you were hospitalized and how you're doing now.
When I was hospitalized, of course, a big part of being hospitalized in this situation is the complete quarantining. So I was limited to the room and walking to the bathroom in the room and nothing else. And the nurses and so forth in their spacesuits checked on me frequently, but because with the nasal oxygen mask, my oxygen levels were okay. They didn't have to consider putting a tube down or anything like that. But the other symptoms were just what I mentioned. Poor appetite, irregular sleeping, cough, stuffy nose. And one of the symptoms that has been publicized and I've noticed real lot is a deep breath hurts, just right here.
So before you got sick, what were you doing to try to avoid the virus? You know, how seriously were you taking all of the stay-at-home and safer-at-home measures?
I was doing all the things that were recommended. When I went out, I had to wear a mask, social distancing, and so forth. And I was going to the store maybe once, twice a week. Usually it was to stop by the pharmacy to pick up something for myself or my wife. And I'd, maybe get one or two items, but complete distancing, mask, everything sprayed, getting the cleaning tissues and all that. I did all of that. So knowing why I got it, where I got it.
No idea.
No idea.
Has your perspective on COVID changed at all since your ordeal? Although you're still obviously recovering, but any change in thought on, what people need to be doing to stay safe?
I think I mentioned before, I'm a retired physician, so I know a little bit about a lot of these things. And actually, even though it wasn't my specialty back when I was training, I did a couple of years of research in pulmonary medicine. So I know a little bit about those things, but I don't think there's anything more that can be done than is being done. And I think really the bottom line to all this is because of the nature of this illness, nobody knows for sure.
Right.
It's just work in progress,
right.
Trying to find out and understand and so forth.
So what advice, if any, do you have for your fellow La Plata County residents on how to, stay safe and get through it if they should become ill?
Well, I think if they become ill, I think if they have fever, bloody cough, or anything like that, get to the emergency room right away. If they just ache all over, feel sore, no fever, eating okay, can walk around the house without feeling out of breath, then I think perhaps be in contact with your primary care physician, but I don't think an emergency room visit might be necessary in that circumstance. But I think it would be a good idea that the primary care physician is at least aware of it
Sure.
and can advise.
Sure.
And I think, in that circumstance, if a particular patient has other significant illnesses, immunosuppressed or severe cardiovascular disease or severe diabetes or all the other things we read about, then they would probably want to be more aggressive in terms of evaluation.
Sure. When you are all the way mended, what are you looking forward to getting back to?
Buy an e-bike and get out and go biking again, which I'd been wanting to do for quite a while. That would still be my hope.
Great. Well,
Yeah.
well, that's my hope for you as well. Hopefully sooner
Thank
than
you.
later. Thank you so much for spending the time and sharing your story. Sure appreciate it.